Part 4. The 90-day natural reset. Reversing diabetes without pills. How lifestyle interventions can restore insulin sensitivity and reverse type 2 diabetes in just 3 months. For decades, the prevailing narrative has been grim. Type 2 diabetes is chronic, progressive, and irreversible. Patients are told that their condition will worsen over time, requiring escalating medications and eventually insulin injections. But this narrative is collapsing under the weight of new evidence. Recent trials have shown that with the right dietary, behavioral, and metabolic interventions, type 2 diabetes can be sent into remission, often in less than 90 days. The natural reset is not a miracle cure. It is the body's innate capacity to heal when relieved of the toxic burden of modern diets and lifestyles. 4.1. The science of remission. Large-scale trials in the last 5 years have demonstrated that substantial calorie reduction and weight loss can normalize blood glucose and insulin sensitivity. When individuals lose even 10 to 15% of their body weight, fat is mobilized from the liver and pancreas, restoring the organ's ability to regulate glucose. This process, described in clinical literature as diabetes remission, is more than glycemic control. It is the reversal of the underlying dysfunction. Patients achieve normal HbA1c levels without medication. In essence, remission is possible because insulin resistance is not permanent. It is modifiable. Why 90 days matter? Why 3 months? Because that is the lifespan of red blood cells, measured through HbA1c, the key biomarker of diabetes. A focused intervention over this time frame can transform a patient's glycemic profile, proving whether lifestyle changes are effective. 90 days is long enough for cellular adaptation, weight loss, and microbiome shifts to manifest, but short enough to be manageable for patients. It is a window of transformation, a quarter of a year that can redefine the trajectory of a life. 4.3. The dietary reset. The cornerstone of the 90-day reset is dietary intervention. Clinical studies comparing low carbohydrate, Mediterranean, and intermittent fasting approaches all show improvements in insulin sensitivity, body weight, and HbA1c. The common denominator is not a single diet, but the elimination of ultra-processed foods and refined carbohydrates. Whole, minimally processed foods, vegetables, legumes, nuts, lean proteins, and healthy fats form the metabolic foundation. Fiber-rich foods nourish the gut microbiome, blunting glucose spikes and reducing inflammation. The key is sustainability. Unlike crash diets, the reset emphasizes nutrient density over restriction, restoring metabolic balance rather than imposing deprivation. 4.4. The role of fasting. Intermittent fasting has emerged as a powerful adjunct. By compressing eating into time-restricted windows, patients reduce insulin exposure and allow the body to switch into fat-burning mode. Studies show that intermittent fasting protocols can improve insulin sensitivity, promote weight loss, and reduce HbA1c in as little as 12 weeks. Fasting is not starvation. It is a recalibration of metabolic rhythms. It restores the balance between feeding and fasting that humans once maintained before the advent of constant snacking and processed convenience foods. 4.5. Movement as medicine. Exercise is not optional, it is central. Skeletal muscle is the body's largest site of glucose disposal. When activated through movement, muscle acts as a metabolic sponge, soaking up excess glucose independent of insulin. Studies reveal that even modest increases in physical activity, such as brisk walking, resistance training, or high-intensity intervals, can dramatically improve insulin sensitivity within weeks. The 90-day reset integrates daily movement, reframing exercise not as punishment, but as a form of cellular reprogramming. 4.6. Microbiome restoration. The gut microbiome is now recognized as a key determinant of metabolic health. This biosis, driven by processed diets, is strongly associated with insulin resistance and type 2 diabetes. During the reset, emphasis is placed on fermented foods, probiotic fibers, and polyphenol-rich plants that feed beneficial microbes. Within weeks, microbial diversity increases, inflammatory markers decline, and insulin sensitivity improves. In this sense, reversing diabetes is as much about feeding microbes as it is about feeding humans. 4.7. Stress and sleep reset. The 90-day reset is not just physical, it is hormonal. Chronic stress elevates cortisol, a hormone that directly antagonizes insulin. Sleep deprivation similarly disrupts glucose regulation, creating a cycle of fatigue, cravings, and resistance. By incorporating stress reduction practices, mindfulness, breathing exercises, nature exposure, and restoring sleep hygiene, patients can rebalance the hormonal environment that supports metabolic health. The reset thus becomes a whole person intervention, not just a dietary tweak. Evidence from the front lines. Trials across the UK, US, and Europe confirm that structured interventions can achieve diabetes remission. In some studies, more than 40% of participants reversed their condition within a year, many doing so in the first 3 months. Patients who had lived for years on medication found themselves free of drugs, free of glucose spikes, and free of the fatalism that once defined their diagnosis. These results are not exceptions. They are reproducible outcomes when the body is given the chance to heal. 4.9. Why it is not mainstream. Despite this evidence, the 90-day reset has not become standard care. The reasons are structural. Pharmaceutical companies profit from drugs, not from lifestyle cures. Insurers reimburse prescriptions, not nutrition counseling, and medical schools devote more hours to pharmacology then to nutrition. The result is a system where patients are told their disease is irreversible because acknowledging otherwise would upend billions in revenue. The reset exists on the margins, promoted by independent physicians, functional medicine practitioners, and informed patients. 4.10 Beyond Reversal, a New Paradigm. The implications extend beyond diabetes. The same interventions that reverse insulin resistance also lower cardiovascular risk, reduce cancer risk, and slow cognitive decline. The reset is not just about curing one disease, it is about restoring metabolic health as a whole. In time, this approach could redefine chronic disease management, food as medicine, movement as prescription, and health as a byproduct of alignment with human biology. Conclusion. The 90-day natural reset is not a miracle. It is not a fad. It is the logical consequence of removing the dietary, microbial, and hormonal stresses that created insulin resistance in the first place. The body is not broken, it is responsive. Given the chance, it resets. The tragedy is not that remission is rare, but that it is systematically obscured. Patients are told that diabetes is forever when in fact, 3 months of focused intervention can change everything. The epidemic of type 2 diabetes will not be solved by another drug. It will be solved by confronting the truth. The disease is reversible and the reset is possible.